Good morning, I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chimene F. Point Michelle, this is your medical tidbit of the day. Today I want to talk about undescended testes. I got a request a couple weeks ago from the Caribbean, specific question on that, and it seems that the decision by the physician and the information to the family was not correct. Undescended testes is also called cryptorchidism, right? It is a condition in which one or both of your testes fail to descend into your scrotum by birth, all right? So normal testicular descent occurs during fetal development, right? So the testes move from actually your abdomen and down into what's called the inguinal canal and into your scrotum late in gestation, right? So that is how your testes come into being in your scrotum, right? So in terms of the incidence of cryptorchidism or undescended testes, it's about 2 to 5%, all right, with one undescended testes. In preterm babies, up to 30%. All right, so that makes sense. It's preterm. It reflects an interrupted, late gestational descent. All right, by 6 months of age, this incidence falls below 1%. All right, because the testes continue to descend. Right. So again, but it can be both sides. Usually, one side is about 70% more common on the right. Bilateral, you have 20% if you're going to have undescended testes, right? So it's one of the most common congenital anomaly that you could find in a male infant, all right? And I'll just take you through the phases because, there's a transabdominal phase because it starts in your abdomen. This is about 8 to 15 weeks gestation, right? And there's several factors that we're not going to get into, right? And then the inguinoscrotal phase where it comes down is about 25 to 35 weeks of gestation, all right? And any of that disruption will result in undescended testes, which I told you the term is cryptorchidism, right? So what causes it? Not quite understand, but it's multifactorial in the sense that it's hormonal, it can be mechanical, right? There can be a genetic or environmental predisposition, all right, which I'm not going to go very much into because there's some basic science that I think is not, part of the discussion, this morning, all right? In terms of, perinatal and environmental risk, prematurity, low birth weight, maternal diabetes, maternal smoking, right? All these things can contribute, to that. And again, there's different types of undescended testes. There's the ones that you could palpate, right? That's up on the inguinal canal, not quite in the scrotal sac, right? And then there's the non-palpable ones, which is higher up in the inguinal canal and can even be up in the abdomen. All right. So there's a lot of things, going on with this. If left untreated, and this is where I want to, nail this point home, there are long-term risks with undescended testes, right? Infertility, right? Because what's going to happen is the temperature, difference damages your germ cells in that testes, right? So that's a problem in terms of fertility. What I want to drive home right now is testicular malignancy. There's a 4 to 8 times increased risk of testicular cancer in undescended testes, right? The highest risk is the higher the undescended testes if it's intra-abdominal, if it's in your belly, right? If you have delayed or absent surgical correction, right? So that is one thing that you have to understand. Another risk is torsion, where it spins on itself, right? And that in of itself can cause a lot of pain. You could lose that testes and a lot of things. And there's a lot more to it, right? The psychological impact, because we when we were young and we were ignorant and we used to tease people, oh, this one has one balls, this one has one this and that. That is not funny. That is psychological trauma, right? And we have to take these things into consideration. This could be an undescended testes that needs to be taken care of surgically. All right. So it has to be important. I remember as a third-year resident, spending time with the pediatric surgeon, Dr. Chang, on my rotation, and he would use the soap on his hands and gently palpate to feel that undescended from the inguinal ring, all these things. But again, if a patient has one testis that's down, you have to find the other one, right? Whether it's ultrasound, whether it's diagnostic laparoscopy, these things need to be done, service to the patient. All right. You could observe these patients until 6 months of age, right? After 6 months, spontaneous descent is unlikely. So then you have to bring it down, all right, surgically, all right? And the timing is usually between 6 to 12 months of age. Early surgery improves fertility, testicular growth, and it does not decrease the chances of cancer, but ease of surveillance, because this patient would have to be need surveillance, right, to be closely watched, all right, especially through the young years. So I just wanted to put that out there. And docs, you cannot see a 16-year-old male with an undescended testes and tell the parents that it's okay. That's wrong on several levels. All right? I just wanted to put that out there as a form of, education, right? So undescended testes is common in premature infants. Spontaneous descent after 6 months is rare, right? Early oculopexy, which is a surgery 6 to 12 months, is important, right? Untreated, you increase the risk of infertility, cancer, torsion, and things like hernia. All right? Remember that undescended testes is not a joke. Peace.